thank you very much to Marielle and to the Welsh Government initiative for asking me to present tonight. The remit of the talk is a very brief overview to try and put these animal health equine clinics into a perspective and look at how antimicrobial stewardship and biosecurity can help to combat antimicrobial resistance in Wales. It's a very, very big topic, but we'll sort of go through some main points which will give you an idea of things that you might want to include in a discussion that you're having with a client in these clinics. So by way of introduction, when we look at antimicrobial resistance in animals and the environment, the government is taking this very, very seriously. This is part of a 5-year plan, which is even just a small part of a greater 20-year plan for dealing with animal welfare, animal health, and the responsible use of antibiotics in our environment, with one goal being to try and keep antibiotics useful for the future of veterinary science. It's kind of been led by the farm animal sector, which went ahead of us. And if we look at what they've managed to accomplish in the last 7 years, they've halved the volume of antibiotics that are now being currently used in farm animals. And they've more than halved the use of critically important antibiotics such as fluoroquinolones and 3rd and 4th generation cephalosporins. And this is an immense step forward. And to get change of behavior in prescribing these antibiotics, it's been a very big combined effort between the vets working in practices, the Welsh Government initiatives, and industry leaders as well, in saying that they want to produce a better product with less antimicrobial input. And we could pass a lot of these ideas on to our equine owners. And so it is now our time as equine vets and equine clients to do the same, to look at what we're doing and see if we can do it better. And this is based on a One Health approach, where we all stand to benefit if we all participate, and the animals will actually be the greatest beneficiary of our work. To give you an idea of a couple of terms that we need to come to grips with when we're discussing these things, we've got antimicrobial resistance, which is the development of resistance within our bacterial species against the antibiotics that we are exposing them to. We then also have antimicrobial stewardship, which is the actions that we take in responsibly using antibiotics. And if done well, antimicrobial stewardship should be the antithesis of antimicrobial resistance. We should delay, prevent, even sometimes wind back the development of antimicrobial resistance by using these antibiotics in a much more logical and much more responsible way than may have happened in the past. Also, we need to think about critically important antibiotics. These are the fluoroquinolones, the 3rd and 4th generation cephalosporins, less important in equine, but important in other species. It would also include the macrolides. So these are antibiotics that we want to be not using because of the implication of what might happen to human multi-drug resistant species of bacteria if we continue to use them in animals. We also have culture and sensitivity testing, culture and susceptibility testing, as it's used interchangeably. And this is an area where we can see a lot of advancement, and we really want to know that we are doing the right thing. And as I've mentioned, the multi-drug resistant bacteria are really the big enemy in our use of antibiotics, and their development is creating problems not only in people but also in animals. So antimicrobial resistance, it is a real thing. But like global warming, it's hard to see in real time. And many people would like to deny its existence for various reasons. One of the problems that we have is that it's hard to get a clear assessment, of what antimicrobial resistance is occurring at any one time. There's very little data collection and reporting of resistance on a national level. And there are goals to try and change that and give us a much better picture of what's happening in our entire nation rather than just what happens in your practice or laboratory. There's also arguments about, well, vets aren't the main drivers of antimicrobial resistance, but we are a contributor, and certainly two wrongs don't make a right. So we need to do things and make sure that we are seen to be doing the right things to prolong the use of effective antibiotics. Also, we want to do our bit to slow the development of resistance. Otherwise, we're going to see some antibiotics become useless, and it might come to a point where there'll be regulations that will remove antibiotics from the control of vets. But again, we have conflicting evidence on the usefulness of antibiotics. When we look at things, for instance, Streptococcus equi strangles, or Streptococcus equi zoepidemicus, a common strep of horses, these isolates seem to have remained sensitive to penicillin, even though they've been used for the last 30 to 70 years quite heavily. But Staphylococcus aureus, methicillin-resistant Staph aureus, has developed major widespread resistance in as little as 20 years. And we also see changes in E. coli sensitivity, with there being increasing resistance to ceftiofur, gentamicin, and fluoroquinolones. So antimicrobial resistance is out there, and we're not getting a great handle on it just yet, but we are in the early stages of really trying to combat this. And the way of combating it is through a continuous process of antimicrobial stewardship, monitoring, evaluating, and reducing the use of antibiotics to preserve the future efficacy and also to protect human health in general. It's certainly a multifaceted approach to the reduction and the rationalization of antibiotic use, and we have to consider a lot of different things that we'll look at as far as prophylaxis, antimicrobial testing, and one important area is to avoid these critically important antibiotics, reducing the use of these antibiotics and preserving them for very important infections or for human infections. Prophylaxis, this is certainly a big waste of antibiotics, and the biggest waste is to use them when they're definitely not required. And we're going to look at ways of cleaning wounds and trying to prevent cellulitis without relying on the antibiotics that we often reach for. Why are we worrying about this? What's the drive behind this? Well, we have seen that the indiscriminate use of critically important antibiotics has rendered them ineffective in some human infections. And it's not just the fluoroquinolones and the third and fourth generation cephalosporins. We are also looking at things like vancomycin, chloramphenicol, metronidazole, and rifampin, all of which have been reportedly used. And, I'm sad to say chloramphenicol, metronidazole, and rifampin are very much overused in the equine world. One of the big problems that we see emerging is that in 2019, there was a paper published in The Lancet that showed that 1.27 million people died of multiple drug-resistant infections in that year. That made it the biggest killer through disease and infection, more than HIV, and more than malaria. So these are people who are dying because even with the best drugs available to them, they have isolates that are resistant. So we really want to turn back antimicrobial resistance. And there's evidence that it's already happening in horses as well, with studies showing that multiple drug resistant bacteria are greatly increased in the treatment of enteric diseases in foals and adult horses. And one of the big problems is that, just as in people, antimicrobial resistance, multi-drug resistance is associated with poor clinical outcomes because we simply aren't able to save horses with synovial sepsis or Enterococcus species foal diarrhea when they are multiple drug resistant. So the Welsh Government wants to implement a plan of looking at antimicrobial resistance. They want to significantly reduce our antimicrobial use or antibiotic use within horses. They want to raise horse health generally. This isn't about stopping us having antibiotics and letting horses be sick. This is about trying to make it so that the horses don't require the antibiotics. We want to collect data and measure our antibiotic use, and then use that information to improve our antibiotic use and reduce unnecessary use. We want to better understand the environmental factors that are driving antimicrobial resistance in Wales and promote responsible use. None of this is prescriptive. The government's not looking to tell vets what to do and how to practice. What they want is for us to look at ourselves, look at our own work and say, can I do better? How can I help with this? How can I contribute? We need to look at the target areas that have been identified. We want to look at prophylaxis. One of the biggest wastes of antibiotics is using them when they're not needed. I often get asked, shall I give this horse penicillin and gentamicin as a combination? But it's only got a skin wound. What are you worried about? It doesn't need antibiotics, most likely. Certainly doesn't need a potent combination of antibiotics. So we've got to let go of the antibiotics. We don't want to be using antibiotics in healthy foals. But if they're not healthy, why aren't they healthy? We need to do more to ensure good cholesterol transfer to foals and make sure that they receive the IgG transfer that is going to make them healthy in early life, rather than giving them a 7 or 10 day course of antibiotics. This is not good use of our antimicrobials. We want to be looking at antimicrobial testing, alternative choices that we might have. We want to be looking at what are the veterinary concerns, how can we educate our clients, and looking at prevention and cure, and looking at biosecurity. And we'll touch on each of these topics as we go through. So looking at prophylaxis to begin with, we really want to reduce our use of antibiotics just because we're scared that something might get an infection. We need to let go of that security blanket. What we need to do is define our surgical procedures as clean, contaminated, or high risk. Certainly if you've got a septic synovial structure, nobody's saying the antibiotics aren't going to be necessary. But if you've not got a septic confirmed synovial structure, then maybe 24 hours of perioperative penicillin for a clean surgery is enough. If it's an uncomplicated wound, it probably doesn't need antibiotics at all. If it is a contaminated synovial structure, then by all means, a 5-day post-operative course of penicillin and gentamicin might be appropriate, and probably is. So we're looking at reducing, we're not looking at eliminating. We also want to improve disease control. Looking at our foals again, controlling Rhodococcus equi rather than prophylactically treating foals against it, trying to exclude it from a yard, trying to improve the overall health of the foals. One of the biggest steps forward in antimicrobial use for Rhodococcus was Steve Giguère and Monica Werner's paper in 2013 that identified the fact that we were treating all of these foals for Rhodococcus and 90% of them were going to get better anyway. So now we know that through ultrasound and identifying how large the abscesses are, we better use our antibiotics only in the ones that require it. Against strangles, there's not a lot of use and justification for the use of antibiotics in strangles, and really we should be able to exclude strangles from a yard rather than have to continue to treat horses. We don't want to use antibiotics when there are no clinical benefits. Intra-articular medication or simple, uncomplicated foot abscesses simply do not require antibiotics to be added to the treatment. If we want to improve our wound debridement and use topical treatments, trying to avoid the use of antibiotics. And in respiratory disease, we want to use cytology, biochemistry, culture and sensitivity to firstly determine the need for antibiotics, because if you're dealing with a viral or self-limiting respiratory disease, antibiotics are definitely not appropriate. And also, if it is a bacterial pneumonia that requires treatment, selecting an appropriate antibiotic for our needs. So testing is very important for that. So looking at this a little bit further, I would look at cytology and biochemistry. We have stall-side serum amyloid A analyzers now, and in our practice we have a policy of looking at the SAA, and if we've got horses that have low SAAs, certainly less than 300, then they just don't qualify for antibiotics. They qualify for anti-inflammatories and supportive care and monitoring. But the cytology might give us an idea, is it truly a bacterial infection? Culture and sensitivity would give us more of an idea of what we're up against. And in-house laboratory testing for culture and sensitivity is very simple. It's not hard. Incubators are not expensive. The plates are not expensive. And if you do it in-house, it reduces the time it takes to get a result for culture and sensitivity. Oftentimes vets complain that it takes 48 to 72 hours to get a culture and sensitivity, which means that they haven't got time to wait for that result. But in an in-house laboratory situation, you could have that answer within 24 hours. We can also generate more revenue for our practices and not be sending money off to an external laboratory. We do it all in-house. You might say, well, we can't identify the bacterial species necessarily, but that doesn't matter, because if you're looking for a truly infected wound, then you're looking to see what the bacteria are susceptible to. You're not looking necessarily at which bacteria it is down to the species level. So there is a lot of good information that can be got very easily when it comes to testing. Looking at alternatives to antibiotic use, we need to look at wounds particularly, because these account for a high proportion of antibiotic use, whether it be justified or not justified in horses. And if we look at sources such as the Beaver Protect Me programs, they suggest that antibiotics aren't warranted in uncomplicated wounds, even if there is significant contamination at the outset. What we want to do is make things better and try and avoid the need for antibiotics. So first thing I think of with wounds is don't add bacteria to them. Wear gloves. One of the big things that is talked about is MRSA. We don't want to be adding that into the wound and then forcing ourselves to have to treat it. So make sure you're wearing gloves so you don't contaminate it further. We need to get better at wound debridement, and this is also being more rapid to get our wound debridement started and get a significant reduction in the bacterial load as soon as possible. For every hour that the wound is contaminated, such as this one, then it does increase the chances that you will get a true infection of the tissues, and then you are going to have to treat with antibiotics. Using non-antibiotic antimicrobials, with foot abscesses, you'd be looking at iodine and sugar. You could be using honey, you could be using silvers. There are lots of different things. Even using topical antibiotics, rather than using them systemically and exposing a greater proportion of the horse's biome to the antibiotics. We also want to use intravenous regional antibiotics where appropriate as well. One of the big ways that we do get debridement is through the use of new tools, such as the VersaJet, which will remove a lot of that contamination without driving bacteria into the wound. So there are things that we can do, but what's holding us back? What are the problems that we find facing us when we're looking at good antimicrobial stewardship? There is professional fear. We're often worried that we're going to be seen as negligent if an infection develops that we may have prevented. But if we're looking at a 1 in 100 event, it simply just does not justify antibiotics. There's a pressure brought to bear on vets as owners expect or demand antibiotics. But the same happened in human medicine, and now it's very difficult to wrestle antibiotics from your general practitioner. So we need to get into better education of our owners. Sharing is a problem. Owners will share unused antibiotics sometimes, and this can undermine our efforts to stop unwarranted antibiotic use. The prescribing habits of vets is also important because we don't all follow the same rules, and there aren't going to be set guidelines, but we should all strive to do better than we were doing last year. And then, of course, there's disinformation, which we see in a lot of media settings these days. And one that comes up time and again is resistance existed before man discovered antibiotics. That may be so. Definitely those genes were out there, and there's evidence that there was antibiotic resistance in some isolates. But by using antibiotics, we're making those isolates more prevalent. So we are raising the level of antibiotic resistance. So just saying that it's always been there is not an excuse for why we should do nothing about it. And when we're looking at clients, we have to look at education. Education is about change, and change is often resisted. So we need to engage vets, we need to engage owners, and we need to get them as all on board to create this change. So we want to inform our veterinary teams and our clients. We want to ensure that the protocols and changes that we bring in cascade down through the entire team, and that there is a central and sort of unified message that's coming out through the team. One great way of getting clients offside is if they hear two different versions of a story. So we all need to be sort of singing largely from the same hymn sheet. One change that has been suggested in literature is that we should lock away the critically important antibiotics. Maybe if we didn't have them in our cars, it would stop us using them so often as a first-line antibiotic. I think there's a lot to be said for thinking about changes like that. We need to educate our clients not to expect antibiotics. And we've used these strategies before. Lots of equine vets have been involved in reducing the wormer use within our clients for the same concerns over the development of resistance. And owners came on board with those plans, and they're likely to come on board with antimicrobial resistance planning as well. So what's the Welsh Government's role in all of this? Well, they're serious about reducing antimicrobial resistance, and they want to help do that by driving veterinary antimicrobial stewardship. They're providing the funding for antimicrobial use and discussions during these clinics with clients. That will open a dialogue with our clients. It's going to help to educate our clients. The government has also produced webinars for equine owners so that they can see from a source different to just a vet, how important this is. And hopefully we're going to be changing client expectations, and it's in joint endeavor to reduce overall antibiotic use. And we are all in this together, and it's going to benefit us all in the end. How do we better use our antibiotics? We want to reduce our use. So we need to employ narrow spectrum antibiotics, just using penicillin rather than a combination. Don't be a pen strep vet. Why use combinations when a single antibiotic would be good enough? So we need to use bacterial culture and susceptibility testing, use it promptly. Use it when the clinical response is less than we expected, or when the long-term therapy might be anticipated. We want to treat effectively. We need to give enough drugs, so we need to get our doses right, get our estimates of weight right in these horses, and we want to give for long enough and then stop. A month-long course of antibiotics is hardly justified in a clinical setting. We need to ensure the dosing protocols provided are correct and logical. Penicillin, for example, we need to look at the marketing authorizations and see that they're not at a consistency with the research evidence. So penicillin needs to be given more than once a day, at probably higher doses than are reported on the data sheet. And also trimethoprim sulfonamides, again, the dosage needs to be more frequent than the data sheet indicates. And so there are times where we need to be looking better and doing what is responsible. Another thing that we can do is to monitor the emergence of bacterial resistance and record this data. Record the use of our protected antimicrobials and record our treatment failures, because that helps us to identify where it would be worthless to try the same thing again and again. We want to respond to the emerging resistance and modify our protocols, and then use this information as part of a clinical audit. And this is a very rudimentary first stage in the clinical audit of our own practice. This is 12 years of antibiotic use in Cotts Equine Hospital. And this is antibiotics used per horse throughout that time. And we see that there are some good signs in this. We see our fluoroquinolone use is going down. We see that our metronidazole use has always stayed quite low, as has use of gentamicin and the cephalosporins. One thing that I would say that we need to look at, and this is only a beginning for us, and we've yet to analyze its full impact, but we do seem very heavily reliant on our oxytetracyclines and doxycycline, whether or not that is and an inability for us to let go and stop treating animals prophylactically, we need to see. And it'll be interesting to see how these trends can change when we start to really apply antimicrobial stewardship to our own practice behavior. And I'd be happy to see this change further and for all of those lines to start approaching zero. So how are you going to do this for your own practices? What can you use? Well, ProtectMe, the BVA guidelines that were produced in 2012 are a great process through which practices can develop their own antimicrobial stewardship. And it is about developing your own guidelines, developing your own structure, and that way it is specific to your clinical setting, and it's also something that you and your colleagues can get on board with because you've developed it. It's not a program that's going to be directed by the government. That simply can't work. But there is a lot of support. We have the ProtectMe information. There are some very good papers that have been produced on antimicrobial stewardship and also antimicrobial resistance. And so we should be looking at these papers and trying to work out how we can best employ them within our own clinical settings. Looking, for example, at this flow chart that suggests when you should and shouldn't use antibiotics. And I would argue that if you used this flow chart and you could say, yes, I applied this to this case and it did not work. Unfortunately, the horse did get a significant infection and it did not go very well. But you would be able to say, I wasn't negligent. I made a choice. I made a logical choice. I did what I probably should have done, but unfortunately it didn't work. So we shouldn't be so afraid of being criticized if we're doing logical, sensible things and trying to reduce our reliance on unnecessary antibiotics. The take-home messages from this part of the talk, really to avoid using critically important antibiotics. We want to avoid unnecessary use of prophylactic antibiotics. We want to really increase our culture and sensitivity testing. We need to audit our practices and our use of antimicrobials. And we need to educate your clients. And through the initiative of the health clinics, where you can start having those discussions with your clients and try and improve their understanding and their animal health perspective. So moving on to the second but shorter part of this talk, we're looking at biosecurity. And it's the old adage of prevention is better than cure. It's about not needing antibiotics because that reduces our antibiotic use. What we're looking here is animal health improvement cycles. This is a major focus of the Welsh Government plan. And again, it's well demonstrated in the farm sector that by improving welfare and using preventative medicine strategies, through animal health checks, perhaps part of animal care plans, we can improve animal health, improve animal welfare, but reduce our reliance on antibiotics. So they're very important things that we want to bring into our discussions with our owners. We want to have an effective animal health planning system, One Health approach, where we've got improved biosecurity, reducing our antimicrobial use, and work that in with, where necessary, the use of vaccination, having good worming strategies, improving nutrition, housing, and even fencing. If we improve our fencing, can we reduce the number of wounds that we're dealing with and the number of times we need to give antibiotics for wounds? And these need to be developed as yard protocols that apply to all clients and animals on that yard. There's no us and them. There's no, well, you need to do it, but the rules don't apply to me. It is all in together. Some of the rules of biosecurity. Number one is isolation. If I could do one thing to stop the spread of contagious disease across the nation, it would be to enforce quarantine of all new arrivals on a yard for 21 days. 14 is not quite enough, 21 is better. And if we could do that, then we would see a lot less contagious disease outbreaks. Unfortunately, very, very few yards do it. And I am involved in teaching biosecurity at the certificate level, and I see it time and time again in the case reports that are presented to me. We need to have dedicated isolation stables. They need to be away from the main stable block for these purposes. People need to have increased barrier nursing precautions, certainly gloves and foot dips, using proper disinfectants, either Virkon or bleach, and using it appropriately at the right concentrations. Putting animals in small and consistent groups to turn them out, not mixing and matching all the time, and letting them share disease from one group to another. Another thing that can be done as far as isolation is concerned is segregating young horses, particularly the foals and weanlings, because it protects them from disease, but also they tend to be amplifiers of disease, amplifiers of viruses and bacteria, and you don't want them then exposing your breeding stock or your sport horses to high levels of microbial challenge. Also, you might want to think about additional temporary isolation areas. Are there specific fields where you could tape them off to allow for greater numbers of animals to be isolated in an outbreak scenario? Rule number 2 would be to eliminate fomites. We need to have adequate personal protective equipment on yards, whether that be gloves, right? Certainly, as we said before, we should be using gloves when we handle wounds, and we should be using gloves when we handle sick animals, particularly foals, because there are microbials that we can, microbes that we can move from one animal to the next. We don't want to be sharing things. We don't want to be sharing tack and grooming kits. Particularly water is a big problem. Sharing water buckets. I don't drink from somebody else's glass. If you're talking about strangles, the way strangles survives in the environment is to find water. It loves to be in a water bucket. A horse with a snotty nose puts its head down, snot rolls into the water bucket, and the bacteria live there quite happily for weeks and then get drunk by somebody else. And that's how we can spread things. So water and water sharing, troughs and things can be big problems. Also, dogs and cats, minor roles in dissemination of disease, but we do need to consider them as potential fomites in certain areas. The third part of biosecurity is going to be looking at overall hygiene of stables. And this is a very big area. Hygiene is a big topic, but there are some things that really come to mind. Stable design. It's not something that you can easily change, but it can be a big factor. And this stable looks actually quite good. We've got our buckets turned over. It looks like it's been cleaned out quite well. We've got separate grooming equipment for each horse. But this is a bit of a nightmare from contagious disease perspective. It's American barn design indoors. So all of these horses are sharing the same airspace. They have half walls with bars. So although they've got their heads out their doors, they can go nose to nose with their neighbors and spread disease. And we have an open drain running down the middle of the building. Open drain sewer systems went out with the Victorians. They are definitely not hygienic. So there are some real problems there with design in this setting, no matter how pretty it looks. So we need to get in there. We need to clean out our stables between horses, moving one horse out and another one in. And certainly if I go to a hotel, I expect the bed linen to be changed between me and the next person. Right? We want to have dedicated stable equipment, and buckets and nets need to be cleaned between horses. Right? We don't share toothbrushes. Also, organic material builds up on surfaces, and we want to make sure that we're cleaning regularly. We want food safety as well. Damp food and rats and mice and birds, they contaminate our feed. That increases the chances of things like salmonella. And water is important as well. Clean water, reducing that challenge. Muck heap location. Is there aerosolized dust coming off the muck heap? Is there runoff of organic waste from the muck heap back onto the yard when it rains? Other aspects of hygiene, follow on from this. So we're trying to reduce infectious challenge. Okay? Most pathogens are associated with the organic material that's within a stable. So feces, mucus, pus, blood, or urine. If you clean away, that organic material, you remove 90% of the bacteria straight away. So you're reducing challenge. By disinfecting, you get another 6 or 7%, and by sterilizing through, say, fumigation, then you can get your remaining area. But it's this organic material that's important. All disinfectants are inhibited by organic material to greater or lesser extents. So we need to remove that organic material and biofilms that it produces before applying our disinfectants. We need to look at how to clean a stable. It's a big job. I'm not going to go through all of these things. You can read them at your leisure, but it is a big job. It requires the steps to be undertaken. And unless your horse learns to use a toilet in the corner of its stable, then it is necessary to regularly clean stables if we're going to keep this environmental challenge under control. Rule 4 of our biosecurity would be social distancing. And it's keep to yourselves at shows and events. Don't mix with strangers. And this is why racing has very little contagious disease spread. Everybody keeps to themselves. They're kept in individual stables. They're not allowed to go nose to nose. Everybody keeps separate. You avoid horse-to-horse contact. You want to maximize your ventilation, and you be careful not to share transport, and particularly don't share buckets. Don't be neighborly. Social distancing is something of our time, and we need to make sure that our horses are doing the same. And the final thing of biosecurity is health monitoring. We need to be vigilant for the introduction of infection into a group. We want to be looking at temperatures to identify and isolate febrile horses. We need to take coughs seriously. Don't just say, oh, it's just a cough. Isolate the animal, trying to get a diagnosis as early as possible, because if it is something that you can prevent the spread of, then you want to prevent the spread. Remember that vaccination can stop the number of animals that are going to become sick within a group. And it can be a very important tool, and it reduces the occurrence of secondary bacterial infections. So again, controlling viruses can help us to reduce our antibiotic use. So, when we're dealing with disease outbreaks, early detection, so again, using our culture and sensitivity, using swabs and PCR, we want to be strictly isolating suspected cases, create a movement barrier, separate our horses into the different groups. And the traffic light system is taken from various groups such as disease prevention steps from the British Horse Society. Okay? And we want to use these systems and put them into place and restrict movement of things. And there is a lot of helpful guidance. There is the British Horse Society, there's the infectious disease and vaccination control methods from Keep British Horses Healthy. Right? There are a lot of things that you can find out there as ways of doing this and guidance as to what your clients should be doing. And if we're improving health, we're looking at vaccination, reducing our secondary infections, reducing lameness. It reduces stress, reduces, if we're keeping abscesses under control, if we're stopping mud fever, then we're stopping antimicrobial use. Clean food and water reduces the challenge to the horse, and so they're less likely to develop disease. Worm control, again, helps with gut health and stops infection from taking hold. And just general good teeth and nutrition also helps to reduce stress. So all of these things are benefits to the horse which don't rely on the use of antimicrobials, but may certainly help to reduce the antimicrobial use on the yard. So lastly, just going over those 5 rules again, we want to quarantine our new arrivals. We want to eliminate our fomites. We want to have much better hygiene and reduce the bacterial challenge to our horses. We want space around them. We don't want them mixing with strange horses. And we want to have good health monitoring and disease identification, and then isolate diseased animals quicker. So thank you. And I hope that this puts antimicrobial resistance and biosecurity into the perspective that it requires, so that it gives you an idea of the things that you might wish to include in your client clinic discussions about antimicrobial use. And now I will hand you back to Marielle before taking any questions. Thank you.
Thank you very much, Shaun, for an excellent presentation. Has anyone got any questions for Shaun first, following his presentation? No? Okay, well, thank you again, Shaun, for that presentation. And so to conclude the webinar, you can now start promoting and holding the equine health clinics with your clients. Please flag up these clinics with your practice manager, admin and finance officers, so that everyone is aware of these clinics and how they work. I'll email you a copy of the process flowchart, the clinic report, a digital copy of the flyer, both presentations this evening, and Shaun's prompt sheet to you all in the morning. And please circulate these to all relevant staff in your practice. Any photos of you advising owners on their yards will be greatly received, and please let us know if you have any potential case studies. Our DGC website has useful resources for you as vets and for equine owners, so feel free to share the links with your clients. And finally, thank you for attending the webinar this evening. We hope that the presentations have been informative and that they will provide you with some structure to your clinics when you advise equine owners. Thank you again, Shaun, and thank you all for attending this evening. Diolch yn fawr iawn. Good evening.